kind of investments that are being made in building hospitals right across this province, and then we will get to Surrey.
Thank you so much, Jenny. So good to be with you this morning, to be with everybody, and talk about the record investments that this government is making in new hospitals, renovated hospitals, new clinics and facilities right across British Columbia. So not just in big centers like Surrey and in Vancouver, but also in smaller communities. So a new hospital in Terrace, northern BC, where people have a harder time accessing healthcare. Brand new hospitals in Fort St. James, new hospital coming in Dawson Creek, and then right down through expanded hospital sites in Prince George, and renovations around the province. But I do really want to talk a lot about Surrey, because Surrey is growing so fast and needs desperately this kind of investment. And that's why our government is so focused on delivering healthcare in Surrey.
So tell us about investments in Surrey, Minister.
Yeah, over $3 billion coming into Surrey. More investment in Surrey than anywhere else right now, because again, it's so fast growing and we've got so much work to do to catch up with underfunding from years past and make sure that people have access close to home. And I know for people living in Surrey, that means not having to drive into Vancouver to get the care that they need. And it's not just in primary care with new urgent and primary care centers for people to access their family doctors, but it's in specialty services too. So the new renal center that is coming to Surrey Memorial, the new cardiac cath lab at Surrey Memorial, a brand new second hospital at Cloverdale, including a cancer center. Surrey will soon be the only place in British Columbia that has 2 BC cancer centers, and that really is a testament to the need and the number of people that have to access that kind of care.
We also know, Minister, that cancer is occurring in very high numbers south of Fraser, and when I looked at that data, it was very, very alarming. So when we're talking about the new hospital in Surrey, do we have any kind of timelines?
Yes, we know that the new hospital in Surrey is scheduled to open in 2030. It'll be a second emergency room, very much needed, of course. And again, the cancer center and an urgent and primary care center right across the street. So we need to continue investing in that primary care networks and system throughout BC and in Surrey so that people don't have to go to the emergency room if they don't need to, for example.
One of the things we've noticed more and more is hospital closures due to shortage of doctors or nurses or staff in general. So what work is the government doing to make sure that we have the next generation of doctors, nurses, and other healthcare workers?
Such a great question. Yeah, it's no surprise to anybody that we're experiencing some real workforce challenges, not just in BC, it's across Canada, throughout the States as well, where we need more physicians, nurses, X-ray technologists, lab specialists. We need all of the different healthcare professions that make our system run. But one of the critical things we need is more family doctors and more physicians. And to do that, we've expanded the training seats at UBC and spread them around the province. But really critically, and so good for Surrey, building a brand new medical school with SFU in Surrey Centre. We just celebrated the announcement of the new medical school. In 1 year from now, they'll be taking in their first students. It's an accelerated 3-year program, and that's the investment we need to make for the future. It is unfortunate to know that we could have avoided some of these problems had the previous government said yes to a medical school, and unfortunately they said no. So we've got to plan for the future. We've got to build out that next generation of physicians.
People of Surrey often feel like the third child, the abandoned child, in many cases, that people forget about Surrey. We're a very fast-growing city, and we have huge needs, both in infrastructure, health, education. So tell us some of the highlights of the things you've been doing to get more doctors and more services into Surrey.
Well, first of all, I want to say I have visited Surrey more times in the last year since I became health minister than I have, I think, in my entire life. It has been so good to be there and see firsthand why Surrey needs more investments in healthcare and what our government is doing to accomplish just that. And we were talking before the break about the new medical school that's opening in Surrey, but of course we have an immediate need for doctors and nurses and others as well. That's why we've been fast tracking credentialing and making it easier for people who are coming from other countries to practice here in British Columbia and especially in Surrey. And so over the past 2 years, we've hired over 200 doctors for Surrey Memorial alone. And that's a combination of doctors that have moved in from other provinces, who have graduated from medical school, and who have come from other countries. We've also hired an incredible number of nurses. So over the last couple of years, again, in the whole Fraser Health region, we have hired 1,600 nurses, and over 750 of them are internationally trained. 200 of those internationally trained nurses have come to Surrey, just Surrey alone. So this
and we're talking about Fraser Health here, right?
We're talking about Fraser Health. Yeah, that's right. So we know, again, like you said, and we all know that this is such a fast-growing city, and that's why we've got to continue to bring in more and more nurses, physicians, and healthcare workers.
Tell us about the Foundry.
Yeah, the Foundry, it opened today, just moments ago, in fact, at 10 a.m. this morning. They threw open their doors and they welcomed young people aged 12 to 24 and their families in a one-stop shop, all under one roof. Mental health counseling, primary care, access to the supports and services that young people need. There's an incredible amount of pressure on young people, and they need a safe, accessible place to come and talk to their peers, to come and talk to physicians and nurses and others, mental health counselors, people who can help them shoulder some of that burden and prevent problems from getting worse. It is the biggest Foundry that we have in the entire province. It's absolutely beautiful, and it's the youth of Surrey who helped inform how it's set up, how it's designed, what it looks like, how people move through this place. Really accessible right next to the Surrey Centre SkyTrain station, easy for youth to drop in, and I encourage people to check it out and to learn and understand how they can make sure that the young people in their lives have access to this place.
Yeah, Minister, we don't have time today, but I do want to have you back to talk about mental health.
Yes.
Because that's a big part of our healthcare system, as you know, and especially about the Foundry and how people can access and utilize the services there, because as you know, mental health is a growing issue right across the province, but I would say we're seeing a lot of it in Surrey as well.
Yeah, it's vitally important that we are able to support young people, stop problems from getting bigger, and give them the skills and the supports that they need to be successful.
So Minister, keep visiting Surrey and keep bringing lots more investment so we can catch up with the huge deficit we do have in healthcare in Surrey.
I sure will. I won't stop working on this. I promise you that.
Thank you so much.